Hello, I'm Dr. Bryan Haas. For many years now, I've specialized in spinal rejuvenation therapy and brain-based therapy. I've studied under the country's leading chiropractic neurologist, Dr. Michael Johnson. Dr. Johnson is the author of the book, What Do You Do When Medications Don't Work? A non-drug treatment for dizziness, migraine headaches, and fibromyalgia, and other chronic conditions. The brain-based therapy that we use in our office has helped thousands of patients throughout the world and throughout our country, especially with dizziness, vertigo, or loss of balance problems. You see, vertigo and dizziness affect millions of people around the world each year. In fact, the majority of the cases, vertigo is nothing more than a temporary inconvenience. In some cases, vertigo is a debilitating condition. Normal day-to-day activities is kept to a minimum due to the severe dizziness and loss of balance. You see, vertigo is classified in two different types. One is called egocentric vertigo. See, egocentric vertigo is subjective vertigo. It's when a person feels like they are spinning in a room. And the second type is called geocentric or objective vertigo. It's when they feel like the person feels like the room is actually spinning around them. The room is spinning around them. This is the person's perception. People may come into my office and may be lightheaded and say, I have vertigo. It's not necessarily vertigo, but it's a problem that definitely needs to be addressed. Okay? You may have been diagnosed with Meniere's syndrome. See, Meniere's syndrome is a decrease or loss of hearing, right? The person may have dizziness with Meniere's, or ringing or buzzing sound constantly in the ear. The reason that's happening is because the temporal lobes on both sides of your brain they could be overfiring. It's usually on the right side. See, if you suffer from dizziness or vertigo or loss of balance, you know, if you're losing your balance, you may have visual impairments. You may have poor depth perception, may be very sensitive to light, and you may even experience headaches. It's very common that you may have headaches. This may have happened to you. You may have problems with memory because the temporal lobe, again, one side, say on the right side, may be overfiring, and the left temporal lobe may be underfiring. So you have canals we talked about in your inner ear. The second cause is the cerebellum. The cerebellum is this back part of the brain right in through here. And the cerebellum is responsible for your coordination, your balance. It also controls all of your spinal postural muscles, all your muscles along your spine, and it terminates eye movements. So when the cerebellum isn't firing, you're going to be dizzy. There's no question. You're going to be dizzy. You're going to have this loss of balance. Feel like you're going to fall down. The coordination may be disrupted. So when this cerebellum isn't firing, we want to increase this firing. And the reason you have trouble with nausea or vomiting is the cerebellum is not firing again like the way it should. And and the other cerebellum may be overfiring. See, again, you may have one that's overfiring and one that's underfiring there. And if it overfires to the brainstem, specifically to what's called the NTS, the nucleus tractus solitarius, the vagus nerve comes off this part of your brain, which is right up through here. The vagus nerve comes off that area, and it goes down into your gut and into your intestines. And this will elicit that nausea and vomiting feeling, you know. And you can see how this happens neurologically. So what do I do as a chiropractor that specializes in treating patients that have chronic dizziness problems, vertigo, loss of balance? You see, I specialize in the neurology. I specialize in treating them neurologically. And the first thing that we do is give patients oxygen. I give patients oxygen. Oxygen is fuel for your brain and your nerve system. You see, folks, your brain needs two things to survive. It needs fuel and it needs activation. Fuel comes in the form of glucose and in the foods that we eat. And oxygen, you see, as we age, our ability to use oxygen starts to decrease. It diminishes. It's called oxidative phosphorylation. So guess what? The cerebellum is the most oxygen-dependent area in the body, so we give them oxygen, and we use what's called an oxygen concentrating unit in our office. This concentrates the oxygen to about 90%, okay? And when we do this, we see almost immediate changes in their vertigo or dizziness when we give them oxygen. And in many cases, not all, but in many cases, because the cerebellum is the most oxygen-dependent area in the body, the person starts to get better immediately, and that is great. It's fantastic. We get oxygen into their system, and they start to feel better already, almost immediately. Okay? Most of the time, we have them do an upper body ergometer as they're doing the oxygen. This is a bike pedal that they're contracting with their arms. It's like a bike pedal they're spinning with their arms, upper body device to stimulate the cerebellum as they're breathing the oxygen. And this can be done from anywhere from 5 minutes to, say, 10-15 minutes to help their cerebellum. This is the activation part of stimulating your cerebellum. We also may do unilateral adjusting. Everyone's heard that the right brain controls the left side of the body, and the left brain controls the right side of the body. For instance, if a patient presents with a decreased firing of the left brain, let's say, the left brain is not firing, the right cerebellum back here fires to left brain. The right cerebellum fires to the opposite side, to left brain. So we would only want to adjust the patient on the right side of the body, on the whole right side of the body. With some of the patients that have vertigo, we'll have them do, obviously we give them oxygen, we'll have them do the upper body ergometer again and do those unilateral adjustments. So the unilateral adjustments are only going to be on the right side to get them better. They no longer have dizziness, they no longer have vertigo or that loss of balance as a result once we do this. We may do a caloric. You may have heard, or you may have a cold caloric introduced into your ear, cold water introduced into your ear to diagnose vertigo or dizziness in many cases. We use a warm caloric as treatment. You see, the warm water goes in your ear, bounces back off, hits the eardrum, bounces back out of your ear, and it comes back into a cup. This allows the endolymph inside the semicircular canals in your inner ear to liquefy. You see, when it liquefies into your inner ear, this then fires back to the vestibular nerve, and this will cause the vestibular nerve will cause the cerebellum to fire properly, to stimulate proper firing of the cerebellum. We may do eye exercises. Eye exercises help fire the brain, especially the occipital lobe, but most importantly, the cerebellum. And for instance, your right cerebellum controls eye movements. The right cerebellum controls eye movements over to your left. It also controls eye movements up to the right and down to the left. And so that's why we want to stimulate the cerebellum. We may use various eye movements to help stimulate the cerebellum. We may use auditory stimulation, listening to sounds in your ear that fire to the brain. We also may do visual stim, looking at a checkerboard pattern or letters. Visual stim, we may have do a whole host of basic therapies to help treat your vertigo, your dizziness, and your loss of balance. But the first thing is we need to find out what is causing your condition. Is it an inner ear problem with that semicircular canals? You know, that BPPV we talked about. Or is it a cerebellum problem? And then we go from there. So once we find out what the problem is, and I want to let you know, is I don't accept everyone as a patient in our office. Okay? I must first determine if you're a candidate for our brain-based therapy. If I feel that I cannot help your condition, then I will refer you to a doctor that can help you. Call the office now to schedule a free consultation with me, and I will review your case history. I will do some initial screening tests to see if you qualify as a candidate for our brain-based therapy. Folks, you have absolutely nothing to lose. Okay? Call now, and I want to thank you for watching this video. I want to wish all of you health and happiness, and I'll talk to you soon. Thank you.